Hey everyone.
Hello, everybody. Good afternoon, good evening. This is Dr. Shiraz Farooq and Sydney Farooq. DaBootyDoc Talk is back in town. How are you guys?
That's right. How are you all doing this evening? Thanks for joining us. So we had a little bit of a hiatus while we were taking care of some things, but we're back to talk to you tonight, and we're sharing our social conversations with a proctologist about what we're going to be doing to educate you guys. So tonight's topic, Doctor?
Thank you very much, guys. Tonight's topic at the Booty Dog Talk today is a taboo topic, which we don't talk a lot. It is fecal incontinence, which means accidental leakage of poop or bowel leakage. So this is something that is very important, and we thought that we should talk about this because a lot of our patients that we see ask these questions, and there are many people in America who suffer from fecal incontinence, which is where the poop cannot be held and it comes out and causes embarrassment and problems.
Yeah, so this is an issue that anyone can deal with. Sometimes it's our surgical patients, maybe after procedures. It could be a complication. Sometimes it's something that we deal with as we get older. Elderly patients deal with this issue. Sometimes we don't know. So that's what we're here for, to kind of start answering some of those questions, find out who it affects, how it affects you, and what we can do to treat and diagnose as well.
So I wanted to go over everything, guys. We are at the Booty Dog Talk. The Booty Dog Talk is a project that we have taken on where we are discussing common layman terminology topics with the public and educating them about common colorectal problems that we can help them with. This is an educational program. It is meant to be entertainment and advice. If you need medical advice, however, please go to your doctor who may be able to give you better information. This is just to give you some educational input and entertainment. We try to mix it with some jokes here and there. So if you find this funny, please laugh with us. Ha ha
ha. Go ahead, you can laugh.
Yes. We are here in Tampa, Florida at Colorwell, America. This is the Booty Dog Talk with Dr. Shiraz Farooq. I'm a board certified colorectal surgeon. This is my spouse, Sydney Farooq, and we are bringing you common stuff about common colorectal ailments and talking about them in a funny manner.
So what's so funny about fecal incontinence?
Do you pass gas?
Of course.
Of course. Yeah.
Guilty.
Everybody passes gas, and if you pass gas involuntarily, and it may be embarrassing to some people, and sometimes it's funny also when you fart, when you have a fart go out or release gas unexpectedly. So all of us know what a whoopee cushion is, I'm sure. As a kid, we've gone through that process where a balloon is placed underneath on your chair and you sit down, and then there's a big embarrassing sound in the classroom. Everybody's looking up.
Those are good.
Out.
We need some of these around here.
Yeah. That's funny. Children, they always talk about poop and diarrhea and passing gas. So that's a common body function, and sometimes it can be funny or embarrassing.
That's right. So now, fecal incontinence might be a little less obvious of a condition, so you're not maybe passing gas obnoxiously, but during passing gas,
that could happen. And when you pass gas, sometimes you can pass some poop with that. So fecal incontinence is where your bowel has no control over the liquid or solid or gas that comes out and causes you to either have involuntary farting, involuntary messing of your pants, and you can poop out liquid, or sometimes even solid poop can come out. And that can be very embarrassing. And it's not that funny, I guess.
Looking back on it.
Correct.
Let's take the humor back. No, but it's not to make jokes of these things. It's to make lighthearted of the situation, to remove the stigma, to remove the embarrassment. We want you to have, a couple of people you can chit chat with about your poop, basically.
So this can be very embarrassing and debilitating for some people. If you've ever heard of grandma smell, Do you know what that is?
Like old people smell?
Yeah, sometimes that's a musky smell, and sometimes we attribute that to fecal incontinence or urinary incontinence. And since incontinence of urine or stool can cause us to have an odor, sometimes that may be called what we call the grandma smell. And so we have to be aware of the fact that some of our elderly patients and population and people can have this embarrassing medical problem, and there may be a solution to it.
Right. So it affects the colon then?
So fecal incontinence is an end organ problem where the rectum, which collects the poop, a colon, which makes the poop and dehydrates the food that we eat and brings it into the rectum. In the rectum, the poop is stored. And then from the rectum, it goes through the anus and outside into the environment, into the toilet. So that valve, that gate that is closing and controlling the function of the poop coming out may not be working. And sometimes that's the cause of the fecal incontinence.
I see. So it's a condition of the colon where it cannot restrict properly. Is it a muscular issue? Is it a nervous issue? Is it a result of a underlying condition?
You have raised some very good questions, Sydney. This can be a multifactorial problems. As you know, the anus is surrounded by a muscular tissue that acts as a gate to control it. So if the muscles are weak, it can be a muscular problem. If the nerves to the muscle are not working, then it becomes a nerve problem. And sometimes it's due to a combination where medical conditions like diabetes or neuropathy or multiple sclerosis or something else can cause us to have accidents. And these accidents involve leakage of stool, gas, or solid stuff.
I see. So if I don't know what's causing this, what should my first act of business be?
Well, some of the causes could also be diarrhea or constipation, and sometimes you can have a rectal prolapse that could cause that, or functional problems of the pelvis. So anytime you have any of these problems, you are going to try and seek medical help. So here comes the colorectal surgeon and the proctologist, and sometimes the gastroenterologist, and sometimes the female doctor or the gynecologist also is involved, because they are involved in urinary incontinence with a urologist or a gynecologist, and similarly a proctologist may be involved also. So your proper doctor is going to help you understand, diagnose it, and then treat the problem.
Now, are there things that can cause it, like that we think might be good for us that are bad? Like we were saying, it might be like a muscular issue. Maybe I work out really hardcore. Do I have to be concerned about, lifestyle habits that would cause it? Or is it usually disease that's causing it, trauma?
So fecal incontinence is mostly a problem of the elderly, where the nerves are damaged or the muscles are damaged or weak. And sometimes younger people, however, can get fecal incontinence also if they have trauma. For example, if you're in a car accident and you have injury to the spine. Now the nerves that control the anal sphincter may be damaged. Mm-hmm. In that aspect, if you're paralyzed and your legs don't work, your anus may not work, your bladder may not work, so you may have dual incontinence of the urinary tract as well as the colorectal tract, and you will leak out urine and poop, and that is a pretty bad thing. So, some other times, pregnancy or pelvic floor abnormalities can also cause incontinence, where a heavy baby may be pushing and you're not able to control. Mm-hmm. Sometimes surgical operations can cause it, hemorrhoidectomy can cause it, sometimes damage to the sphincter can lead to it. So there are many ways that the anus is functioning, and a lack of that function can be a cause of the problem.
So it sounds like typically if you're a young person, even if you're maybe a healthy person with some bad habits, you're probably not going to encounter this issue unless something traumatic happens in the area, or there's a special event like pregnancy or surgery, or you're reaching those elder age years where you're starting to leak some places you don't know where. So that's what we're here to help you figure out, where's this coming from. But what I was gonna ask is, are there indicators of it where, like I don't just wake up one day and have fecal incontinence? Is it something that happens progressively over time, or it sounds like it's kind of like related to an incident? And I was wondering if I like maybe start noticing some things and questioning, like, do I have fecal incontinence? Am I encountering these issues? Are they temporary? Are they going to last?
Well, for people who have fecal incontinence, sometimes they will have leakage of gas where they're involuntarily leak out gas and they can't hold their farts. So they'll be in a social situation, a conference, or somewhere else out on a date, or be with their parents at Christmas, and they may release some gas, and everybody's like, "What's that odor here, guys? Who did this?" Or that may happen. Sometimes you wake up and you have poop on your underwear or poop in your diaper. So a lot of elderly people may have soilage of their clothes or undergarments. So if that starts to happen, then you start to worry, do I have this problem or not? Most of the time, fecal incontinence may happen at night when you're sleeping and you wake up. And just like when we were children, our bladder is not functioning, and little babies and little boys and girls may leak urine. Sometimes elderly people may leak poop and urine because they have lack of control of their anus and their rectum may not be working. So that is fecal incontinence.
Could it be an indication, say, if you are healthy young, you don't really meet those marks and you're experiencing incontinence, does that mean something is wrong with you or serious?
Correct. If something happens, if you're young and all of a sudden you don't have control of your anus, that's a very big deal. You would be alarmed because that's not a common body functional problem. So in that case, you will have to go and seek medical help.
Makes sense. So tell me then about diagnosis. I'm pooping my pants at night. I'm 70 years old. Maybe I'm a little bit younger by then. You might start realizing it. I don't know. I come to see my doctor, my specialist, whoever it may be that I come to for help. You named a few options earlier. How do you diagnose me?
So a lot of times your doctor is going to take a detailed history. He will ask about what you're doing, how your daily your habits are. Are you exercising or not? Are you eating fiber or not? Are you taking any medications? What medical problems you have? What surgical issues you've had? Have you had any surgeries in that area? Have you had any injuries? Do you have any neuropathies, diabetic problems? All of those. After that, your proctologist or your gynecologist or the urologist or the gastroenterologist may do what's called a physical examination. In that part of the interview process, they're going to have a look at your anus. They might have to check the tone of the anus by inserting a finger and doing what's called a digital rectal examination, where the famous proctology finger goes inside, you bend over, and they ask you to cough and squeeze. And when they ask you to cough and squeeze, they're trying to look for the anal pressure to see if your anus or your bottom has enough tightness around it to hold or not. And if it's very loose, that means that you may be prone to having accidents. So they might do what's called an anoscopy, which is looking inside with a small tube that may have a light or a camera. After that, they may recommend a colonoscopy, a specific test, just like we check the pressure of the tire. Okay, so tire pressure check. In the same way, you may have a pressure check of the anus with a specialized instrument that is known as anal manometry. So your manometer is a pressure tube that checks the pressure in the anus. So that may be required.
Now this sounds scary, but you don't get inflated like a tire and then released all the pressure.
No,
But
no, no.
it's a 10-minute long exam. It's usually done on location wherever it's performed, maybe in a doctor's office, for example. We can perform this procedure here at our specialty practice. You don't have to go to a center or a hospital. And then it's a little catheter thinner than my pen, and there's a very small inflatable balloon on the end.
Correct.
So that can get the measurements that you need, and you do a series of simple squeeze, cough, push, and then we get a report.
Correct. After that, there are certain other tests. You may require an ultrasound of the muscles. That can be done at a specialty center where they look at
And
the
is that looking
muscle.
for damage?
That's looking for damage. That could be caused by obstetric trauma if you've had babies in the past. You know, there's a lot of women who've had forceps deliveries or had a traumatic breech delivery. 30 years later, when their boys and girls are in their 30s and 40s, their mom is having accidents and wearing diapers, and that could be due to a traumatic childbirth that may have happened, that may have ripped the muscles of the anus along with the vaginal wall. Mm-hmm. Sometimes when babies are born, the gynecologists have to cut through the vagina, and if the cut is very big, it can also cut through the anus, and that can cause problems. So that becomes a problem also. So similarly, you can also check the nerves in that area by doing a special test called nerve conduction study. Mm-hmm. Other tests that can be done include an MRI, which is an imaging test of the anus. You can do a CAT scan, and then there are special tests where you can actually make the patient or the person poop by injecting some radio-opaque dye inside them, and then that is called a defecography, where you take a picture as you're pooping. That sounds very gross, but this is done in an MRI machine.
When is pooping ever not gross? I mean, I kind of like it because it flushes you out. It's a good disposal system, but it's always on the gross end.
Yeah, it is. It is kind of gross and embarrassing, but this test.
Facing the facts. The tests are necessary.
The tests are necessary and sometimes embarrassing, but they can help.
We do not do the defecography test here, so you can come poop somewhere else.
For that, you have to go to a hospital or a diagnostic center which has this machine.
I mean, personally, I think it's kind of cool instead of gross. I mean, who wouldn't want like a video recording of themselves from their poop's perspective?
Well, it gives us a radiologic imaging of the poop, because the poop itself has radioactive dye. Mm-hmm. So you're able to see the inside workings of the sphincter muscles to see how the poop is coming out.
So you see whether it's like being compressed.
Is it coming out? Is it coming out the right way? Is the angle right, etc.
Do you ever find anyone with like 2 poop holes? Is that a possible
that's
thing?
a possibility. That's called a fistula. So that can happen.
Oh, I was kind of joking, but
no, that can happen. Anything can happen. Medicine is very gross and very
interesting. That's not exactly what that is. I meant like a 2-headed snake.
So. No. Anyway, let's not go there. So
you wanted some humor.
So what do you? I mean, humor is there, but we gotta keep it on the low.
So what are my treatments then?
So next step after diagnosis is, what do you do about this, doctor?
This sounds like a surgical thing.
No, first things first. First things you have to do is make some behavioral modifications in your diet.
There's not like a little rubber band you can attach there or something?
No, that's a very interesting concept. No, that has been done.
That's what I would do, like tighten that butthole up.
You can tighten the butthole up, but that doesn't work all the time. So the first thing, what do we do?
Plastic surgeons. There you go, guys.
No, first things we do is what? Always diet. Then here comes the big drum roll, guys. What's the biggest thing in your diet that you're going to do to change to improve fecal incontinence?
Eat more
fiber. Guys, fiber is one of these magic fundamental diet products that can.
And you eat fiber? I want to hear it right now. Is he right?
Fiber really helps. So stool bulking agents make the poop bigger, softer, and the anus is a muscle that is sensing the poop. So when it senses larger poop, it means that it can contract. If it senses liquid small poop, it cannot contract and hold it. So a larger poop bolus that passes through with fiber will be compressed and the gate will work. If
Now
the-
that sounds concerning. You're like, I don't want my poop to be larger, but it's not that it's making it excessively large. It's bulking it to the proper consistency,
Yeah.
so your body gets the right triggers and activates the right measures to get it out.
if you are passing lots of diarrhea in liquid poop, okay, your sphincter may not be able to hold it and you leak it out. But if it's solid and it's firm, then the gate is going to be able to clamp on it and close it. So that's the functionality of the anal sphincter, is to control and let the poop not come out. Now the interesting part is there are two muscles in the body that are always working. Do you know what they are? One is the heart muscle that is always beating. The other is the anal muscle that is always contracted, holding your poop inside.
I never really thought about that.
So that when you're sleeping or when you're talking or when you're coughing or walking, you don't leak poop because the anal muscles are working. So these muscles have a function to control and hold the poop.
See your comment down there.
And
that's right.
If the bowel movements are liquid, you're not going to be able to hold them. So adding a fiber supplement that concentrates the poop and makes it bulks it up, just like cornstarch can bulk up, your soups. Similarly, fiber added to your poop makes it bulkier and easy to control and close. So it becomes easier to hold it and you don't have so many accidents.
And fiber helps with the consistency. So
Correct.
If your poop is too hard, if it's coming out in little pieces, then you can utilize fiber to help get that right consistency. So
the other thing that is so important for our patients and for the public is sometimes medicine is required. So you may require medicines that can control the diarrhea. So if patients have a lot of liquid poop, we give them medicines to hold them and control the bowel function. So Imodium and Lomotil are two of the medicines we use.
What if I don't like medications?
Well, fiber, food changes, medications. Then
I know you said lifestyle changes.
Then the other lifestyle changes are pelvic floor workouts.
I can work out my butthole.
Yes, you can work out your butthole. Absolutely right.
There's got to be a gym equipment for this.
Well, it's called the Kegel exercises, Kegel.
Okay. I've heard of this before.
So Kegel exercises are basically pelvic floor exercises for the bladder and the anus.
I was going to say it's good for your other region as well, right?
Correct. So
wait, do guys need to do pelvic floor exercises?
Yes, guys can also do pelvic floor exercises. Basically, whenever you're trying to pee, okay? If you hold your pee, there's a muscle that's involved to control and stop the pee. If you practice that, you can build that muscle up. So think of that as a workout for your biceps. So if you have a small 5-pound dumbbell and you work out, or 10 pounds or 20 pounds,
that's a strong butthole you're going to have.
You're going to have Popeye arms and you may have a Popeye butthole, okay?
Wait, can Kegel exercises give me hemorrhoids?
Not likely, but Kegel exercises can help you with your hemorrhoids.
Okay.
So, Popeye eats a lot of spinach?
By the can.
By the can. So,
that's why he's popping out.
So bulking your anus with exercise and eating stool bulking agents like ground flaxseed
will give you the power to poop like Popeye.
Correct. This is very true.
And eating all that fibrous spinach is really giving him a good poop. So.
And also another thing that is important is the angle of the bowel movement. So if you sit on the toilet and if you raise your feet up, there's a device called the squatty potty. Basically, you are allowing the bowel movements to come out easier so that they don't get obstructed. Mm-hmm. And that way, you don't have problems involving fecal incontinence and issues like that.
So you're saying if I am unnecessarily putting pressure on my butt while I'm reading my phone for an hour on the toilet, I might get fecal incontinence sooner than later?
It's a possibility that you'll have anorectal problems, including sometimes fecal incontinence and or constipation, hemorrhoidal issues like that. So yes, you can have that. But these are some of the medical things that you can do to help. What is next is going to a surgeon like me or my colleagues in the gastrointestinal world gynecologic world or the urological world who may be able to do certain things. You know, there's a thing called a pacemaker for the butt.
Oh,
Yes.
wait, yeah, we've used them before, the nerve stimulators.
Yes, the nerve stimulator. So
Like, have you ever had a muscular device where what are those called?
TENS machine.
TENS machine.
It's shocking. It gives you an electric shock. You know, just like when you touch somebody and you get a shock and you get zzz. So this is basically electrical activity to the pelvic floor.
So you can opt to shock your butthole into working.
Don't use a 9-volt battery
On your tongue.
on your tongue or your butthole. That's not going to work.
But what he's talking about, these are surgical options, but they're pretty much non-invasive. So you have different nerves in that area, and they very.
What's going on back there?
This area back here.
Okay.
So I can't show you on camera. The doctor will implant very small little electrodes in there that you have a machine on the outside of your body, and those impulses you can operate from the machines that stimulates that area. So it will contract and spasm the muscle.
And that will build up the muscle tone. Also, you can do what's called a sphincteroplasty, where you can operate and put the muscles back if they've been damaged.
So kind of, I was joking about plastic surgery later, but there are,
anoplasty, like procedures that are done by colorectal
reconstructive type
Techniques,
surgeries, but it's
yes.
done by a colorectal surgeon,
Yes, yes.
not a plastic surgeon. And we even have worked with patients with injections before too that do something similar. So you can inject kind of a lump into that area,
It's
right?
called, you can make speed bumps. Truly, yes. You can make speed bumps to slow the passage of bowel movement and make it not go out so many times. So you can make an artificial gate. You know, it's like you were talking about a rubber band. In the past, people have used plastic circular devices like a pessary, where you can try to close the anus.
Mhm.
And there are magnetic devices also that try to do that. None of them have really worked so far because they all get messy.
Well, and you don't know what's going to
infected.
come out. Like,
Yeah, and they get
you
infected.
don't want something
and
to
damaged.
stuck there or
Exactly.
damaged or hurt you. Yeah.
So that's always
It's a sensitive area.
So it's a very difficult and embarrassing topic because a lot of people don't talk about it.
And that was the last thing I want to talk about. We got a couple minutes here, but obviously there's a lot to talk about, like what your options are, but you gotta like get there first to even address the issue.
So a lot of patients will go to their doctor and say, "Doctor, I have a lot of diarrhea." But they don't have diarrhea. What they're trying to tell their doctor is that they can't control unexpectedly leaking.
Yeah.
So please listen, guys. If you have somebody who's having bowel problems, who's having issues like this, we recommend that they go see a specialist like a colorectal surgeon, a specialized gastroenterologist, a urologist, or a gynecologist. These doctors or the team of doctors together and pelvic floor therapists can work together to make your butthole amazing.
But the point is,
What butt? B-U-T or B-U-T-T?
TT always. But you should take opportunities to ask professionals if you have any concerns. Maybe you had never even heard of fecal incontinence before, and you literally think, you're like, why do I have diarrhea all the time? What am I eating? What am I doing? You're addressing the issue wrong. You don't even know where to start. You come see a specialist, and in 1 minute he can say, that sounds like fecal incontinence. What's that? So don't be too shy. Don't wait years. Pregnant ladies, you're gonna have problems. You're gonna have hemorrhoid. You might have fecal incontinence. It might not happen until 20 years later, but don't wait to address these issues.
And last topic, eat more fiber. Because if you do that, you're going to improve your digestive health. So off the bat, you're off to a better start if you add fiber.
So if anyone you know is complaining, you yourself, about colorectal problems, start off with, well, I should eat more fiber. Or do you eat fiber? Because that's the first thing we're going to tell you too.
Absolutely. And with this, our time is up, guys. We are very excited to be back in town in Tampa, Florida. This is Dr. Shiraz Farooq and
Thank you guys for joining us.
This is an episode of DaBootyDoc Talk. Today's topic was fecal incontinence.
That's right.
And we are very happy to be here.
So hopefully we started the discussion for you. If you have more questions, comments, put them in our posts here. We're going to be updating for next week, probably on Monday or so at the beginning of the week, to let you know what we'll be talking about next time.
And thank you very much for joining in. We appreciate you all. Have a fantastic day. And
I know the sun looks like it's going down back there, but It's really still bright outside. It's summertime, so you guys go out there, enjoy your evenings. Let us know what you want to hear about next week.
Thank you very much, guys. Have a fantastic evening.
Bye.
Bye-bye. Thank you.